Good afternoon, everyone. We are starting a town hall here for the organization here at Southlake to help with some of the questions we've been receiving around pregnancy, vaccination, birthing, all in the context of COVID infection and vaccination. This has been sort of a challenge, not just for our community, but provincially and nationally. And so I think there's a lot of people who have some unanswered questions and are seeking some guidance to kind of help answer them more individually. So we thought it'd be a good opportunity to share an expert panel with our community, that being internally and externally, to help support everyone. So I'm going to just give a brief description of each person here on the panel, and then we will move to each of them having a short statement about what they represent and invite questions, and we'll answer them as they come. So from our Department of Obstetrics, we have Dr. Genevieve Chang, who's our Chief of Obstetrics and Gynecology, and Ms. Carolyn Scott, who's our head midwife, representing our leadership in the midwifery group. We also have Dr. Maddie Drake, who's one of our pediatricians and neonatologists and specifically cares for our premature babies. And then we have Jenna Nightingale, who's a York Region public health nurse who has recently had her own child as well. And Jessica Faruga, who is a patient who did not receive vaccination and was admitted to hospital with COVID-19 while pregnant and has some of her experiences to share also. So those are our panelists for today. We're really looking forward to this opportunity to share with you what we know about this area of vaccination and COVID-19, and at the same time really be available to you to help answer your individual questions. So I'll turn it over to Lindsay and she'll guide us through.
Okay, great. So Dr. Chang, did you want to introduce yourself and say a bit more?
Hi. I don't really have much more to add. So I'm Chief of Obstetrics and I'm happy to be here to answer any questions. Hopefully I'll be able to help.
Okay, that's great. So then did we want to start with Jenna's experience as a public health nurse and also getting vaccinated while being pregnant, correct? Jenna, did you want to just talk about your experience with that? Okay, so I'll send you last.
I'm a nurse that works in public health, and I actually got redeployed during COVID. So I actually had the opportunity to do the investigations into the adverse events following the COVID immunizations. So it was definitely an interesting field to work in during COVID and being pregnant. But basically, when the vaccine came out, it was new, everyone felt a bit uncomfortable. And I could be wrong, but I remember initially that in the very beginning, it wasn't even really an option for pregnant women to get vaccinated. And then shortly after, sorry, I have my little one here with me. And then shortly after, it was available to pregnant women who did want to get vaccinated. And I'll start off by saying that I actually was diagnosed with COVID almost a year ago, so the beginning of the second wave, October 2020. And that was a bit of a traumatic experience, even though, my family and I were okay and it was a mild case. So when I was pregnant and, we were hearing in the news that, pregnant women are getting more severely ill. I think there was a decent number of pregnant women in Mount Sinai's intensive care unit who were extremely sick and ventilated. And this was happening all around the same time that, I was in my second trimester, and we were just noticing, that pregnant women were definitely getting more sick, and literature was saying that as well. And having been through COVID the first time and having it, definitely not something I wanted to go through again. And I did have concerns about the vaccine. It took me probably a couple weeks to decide what I wanted to do. But then I just, I kind of broke it down in my mind. I said, you know what, for years, pregnant women have gotten their flu shot every flu season. Pregnant women are told, to get their pertussis vaccine in pregnancy as well. So it seems like, with other vaccines, we don't really think twice about it. We go and we get it to protect ourselves and the baby. But the only difference with this vaccine was that it was brand new. And so, you know, I kind of just had to break everything down and think about it logically. You know, vaccine technology is not new. Vaccines are not new. It's just a thing that we're all anxious about. And really what pushed me to get it was hearing that stat about Mount Sinai's ICU. It terrified me. And, you know, I have a toddler at home, and I know that, you know, not only to protect myself and the baby, but I have to be around and be healthy and be okay to, you know, take care of him as well. And being in public health, you know, just wanting to get vaccinated to, like everyone else wants to do, you want to get vaccinated, protect others from getting sick, reduce transmission. I just wanted to be a part of doing my part. You know, and getting this pandemic under control. And even when I went to go get vaccinated, I had asked the doctor, I'm like, the doctor vaccinated me at a clinic. I said, how many pregnant women have you had here today? And he said, none. And I remember sitting there thinking, okay, you know, that's not exactly what I want to hear, but it doesn't mean anything. And it doesn't mean that it's not safe. It's just, I think naturally when you're pregnant, you want to do the best thing for you and your child. And, you know, it makes sense that people are hesitant and they think twice about it. But when you consider how sick you can really get, I know that someone's going to speak to that as well. It's scary. And I know that a lot of people think, you know, the likelihood of getting COVID is so small, and look at the positivity rate and the numbers. I thought that too when I got COVID a year ago. And, you know, my husband and I both work in healthcare, and we both took COVID extremely seriously, and we still got it. So that was a real wake-up call for me that I had that prior experience. And just touching upon my work that I do in public health, again, you know, this is just my personal experience. Doing the adverse event investigations, not one investigation I dealt with or phone call I dealt with had anything to do with pregnancy. So all the adverse events were things that, you know, we expect from vaccination, feeling unwell, you know, the odd unlikely thing. But when I was, you know, thinking about everything, I thought, you know what, not one case I had to do with pregnancy. And so that's where, you know, I kind of looked at it from a scientific perspective, having to be healthy for my family. And also a lot of people who are pregnant, I think that you constantly think about what supports am I going to have? What kind of help am I going to have when I have the baby? And I thought, well, if I get vaccinated, there is a chance that the baby does get some antibodies as well. So I'd feel a little more comfortable having grandparents, aunts and uncles come in and help, so I could have that support as well. So that was another important thing in my decision making, is that, you know, I'm going to want to have help, and I'm going to be worried about my newborn. And if there's any chance that there can be some protection, you know, passed through to him, that's something I'd like to do as well. So everything worked out. There has not been any issues. I'm very happy. The second I got immunized, I actually felt a huge sense of relief. Haven't looked back since, not regretted my decision. And I was actually able to return to somewhat of a more normal life once I did. I was less scared to go into the grocery store, less scared to go run errands. These are things when I was pregnant and not vaccinated that really made me anxious. And so I felt empowered after I got vaccinated, and didn't feel like, you know, I had to stay home and not leave.
Thank you, Jenna. That was really helpful. Thank you for sharing. So maybe we'll go to Jessica, who was a patient at Southlake and sort of had maybe the opposite experience. Jessica, if you're ready to speak to that.
Yeah, sure.
Thank you so much.
So I'll start by saying I'm 35 years old. I am otherwise healthy. I was working out every day. I was running until I was 8 months pregnant. I was going to the gym every day. So it's very overall, according to like my blood work and everything else, I was healthy. On the 21st of August, I was feeling like I could not breathe anymore. I went into the emergency room at Southlake. Southlake emergency sent me to the birthing unit. The birthing unit is kind of confused because they're like, okay, you're 35 weeks pregnant, but you're not dilating. You don't look like you're in like you're ready to give birth. And And then I think it was like early in the morning, my BPMs were over 200, so was the baby's, and then the baby had dropped to 60. And Dr. Watt, the OB on call, was said I had to have an emergency C-section. And although I wasn't ready to have my baby, because I was barely 35 weeks, he was born and sent directly to the NICU, and I'm very thankful for the NICU because the people that work there are absolute angels. They ended up taking care of him for 2 weeks. I was sent to internal medicine on the 6th floor, where basically the effects of COVID, I was one of those pregnant women who said no to the vaccine because I was scared of myocarditis for my baby. I had concerns, and even though Dr. Sasha, which was my OB, had assured me that it's likely the right decision to make to be vaccinated, I didn't take his word for it, and I didn't take his advice. And unfortunately, it was just, to me, it was, if I can describe it, it was hell, because I couldn't hold my baby, I couldn't see my baby. They were, the girls at the NICU were fortunate enough to FaceTime me with my child and send me pictures, which I'm forever grateful for, but I missed the first 2 weeks of his life. My speech was blurred for the longest time. I basically was able to speak normally after, I think, like 2.5 weeks after recovery, which was really scary because, I work in sales, so speaking is part of my job, which I didn't think I was going to get back. I had to learn how to breathe again because I was doing the therapy that the Southlake doctors, the therapists were giving me, and basically I couldn't make it over, I think it's a spirometer, I think is what it's called, and I couldn't make it over 500 at the time because I just couldn't breathe. My blood pressure was out of whack, which was unheard of for me because I always had regular blood pressure. So I basically, I had the worst, I guess, effects that people can have with it. But again, I didn't weigh the pros and cons correctly, right? I just, I listened to information that I saw on the internet, and I didn't make, I believe now, looking back, that I didn't make the right decision, considering that, it could have been worse. But I definitely don't want to relive the COVID, just having COVID, period. I don't want to relive it. I ended up getting the Moderna vaccine last week, my first dose, and as soon as I can get my second dose, I will be getting it. So.
Thank you so much for sharing that with us. Obviously, sorry to hear about your experience, but glad that you and baby are okay now. So I guess from there, maybe we should get into some questions that were pre-submitted. If you do have any that were not in the chat here, I put them in. You can write them in, and we will publish them. But the first one, I think, is: do we know why COVID-19 is so much more severe for pregnant people? Who would be best to answer that, do you think?
I'll try.
Dr. Shea? Okay. Thank you.
Actually, we don't know why it's more severe in pregnant people. We know that there are changes in pregnancy in terms of immune system and changes in terms of your breathing capacity. And that may be related to why it may be more severe. Actually, let me back up a little bit. COVID, most pregnant people who get COVID will have mild disease. Okay, so it's not that most pregnant people will get really sick. but there is a small proportion that will get really sick. And the risk factors include age over 40, if you have a pre-existing condition like diabetes or high blood pressure, if your BMI is over 40, those kind of things will increase your risk. But most people, just like most non-pregnant people, the disease is mild. However, in pregnant people, 8 to 10% of people who are infected will end up being hospitalized, which is a lot higher than in non-pregnant people. I don't think that a lot of diseases affect pregnancy differently than non-pregnant. I haven't seen an explanation to why it's more severe. So there is a small proportion that's severe. Most are fine, but if you get the severe disease, and actually, even if you don't get the severe disease, there are consequences to the pregnancy from COVID infection. So we know that there's an increased stillbirth. We know that there's increased prematurity. In the severe group, there's increased diabetes. So there are consequences to COVID infection in pregnancy that you may not see in non-pregnant people.
Thank you.
So that's not a direct answer. I'm sorry.
No, that's helpful. I know that, and Jessica had mentioned to me earlier that she did still have some lingering effects from COVID, after, this is all done. So, yeah, that's good to know. Okay. So is it safe to get vaccinated while pregnant, even in the first trimester? Is that you again, Dr. Chang, or did you want? Yeah, you're still live. I think you're muted though.
Sorry. So all the bodies that look after pregnant women, so the Society of Obstetricians and Gynecologists, and also the fertility societies that are worried about fertility, they all recommend that women be vaccinated when they can. So if you're not pregnant and you're trying to get pregnant, you should be vaccinated before pregnancy. Then you don't have to worry about whether you should be vaccinated during pregnancy. If you're already pregnant, you should be vaccinated regardless of which trimester you're in. That's the recommendation. So yes, I would say if I see a patient and they're telling me they want to get pregnant, I go get vaccinated. Then you don't have to worry about what's its effects on the baby, although there hasn't been shown to be any effects. And if they're pregnant, again, I don't make them wait after the first trimester or anything like that. I just tell them to get vaccinated right away. One of the reasons why some doctors will say wait till after the first trimester is a lot of 30% of pregnancies will end up in a miscarriage in the first trimester. So if you get vaccinated and you have a miscarriage, then we worry that you're going to blame it on the vaccine. So sometimes they say wait till after the first trimester just so you don't attribute something bad that happens to the vaccine. So it's not that they are concerned about birth defects or anything like that. There has not been shown to be increased miscarriage. There has not been shown to be increased birth defects in babies born to women who were vaccinated during pregnancy.
Okay, we have two similar questions here about, well, one was pre-submitted and one just came in. So do we think that COVID-19 vaccines have been tested enough on pregnant people? And then the second, two-parter, I guess, is why do the product monographs say that safety has not yet been established in pregnant women or breastfeeding?
I think
Lindsay?
Carolyn raised her hand, so.
Yeah, that's what I was just going to say. Carolyn had her hand up.
Okay.
Yeah, one sec.
Carolyn, before you answer, did you want to just reintroduce yourself so everybody
For sure.
knows who?
Hi, I'm Carolyn Scott. I'm a registered midwife with Midwives of York Region and happy to be part of the maternal child team at Southlake. I just wanted to add on about the safety of the vaccinations that the Center for Disease Control in the United States has been following with pregnant women who have received the vaccination, and they followed over 30,000 women so far, and there has been no increase in numbers with miscarriages or abnormal outcomes in pregnancy related to people who have received the vaccination. So it just goes to, I think, just adds on more further information about the safety of the vaccination.
Okay, thank you. So we have COVID vaccines been tested enough on pregnant people? Is the question that was pre-submitted. And then why do the product monographs say that the safety has not yet been established in pregnant women or breastfeeding?
So let me try and take that.
Oh, sure. Okay, go back to you. Dr. J. Thank you, Carolyn.
So
Okay,
when they do trial, before a vaccine is approved, you have trials, and then that is part of the product monograph that they submit to the government, and then the vaccine gets approved. And in most medications, including vaccines, pregnant people are specifically excluded from the trial. So if you're pregnant or you're trying to get pregnant, you're not even eligible for the trial. So when the vaccine studies were being done, pregnant women were not. If you were trying to get pregnant or you were pregnant, you couldn't be part of the study. So that's why the product monograph says that, there's no data or there's not enough data in pregnant women. Now, you have to remember these vaccines were approved in 2020. So since then, as Carolyn says, we now have a lot of real life data that has been gathered because this vaccine has been given to lots of pregnant women. In terms of in the US, let me just look it up for you. Like they have CDC is keeping track of how many pregnant women have received the vaccine, and I think it's over 150,000 now that has received the vaccine. And we in Ontario, we have a registry called BORN, Better Outcomes Registry and Network for Pregnant Women and Childbirth. And there's been over 40,000, this was data as of June 30th. In Ontario, over 40,000 pregnant women had received at least one dose by June 30th, 2021. That was the most recent data that I can get. And in the US, 160,157 women as of September 20th has received the vaccine. And so these are the number of women that received it. And then we also have lots of mechanism to track side effects. So there's mandatory reporting of side effects, but there's also registries specific to COVID vaccine and pregnant women in both US and in Canada. So in the US, they send you an app, a web, like a phone-based app. And if you say, yes, I agree, then they send you regular questionnaires and pregnancy outcome. And they have followed 5,104 out of the 160,000 that have been vaccinated. Over 5,000 of them have said, okay, I will participate and I will answer your questions on the app. And they have not shown any bad outcomes. Now, so a lot of the, I think all the vaccines in Canada except Pfizer have their own separate registries as well of adverse outcomes. And I know that Pfizer was trying to have a study looking at comparing vaccinated versus non-vaccinated pregnant women, but it was supposed to be randomized, like you don't get to choose which one you get. They're having trouble enrolling people because the vaccine is recommended. So you're not supposed to do trials like that unless you don't know what the answer is. So if the vaccine is recommended and safe, then it's hard to do a trial and not give people the vaccine.
Okay, that's great. Thank you. Did anybody else have anything that they wanted to add to that answer? No. Okay. So there's some so is it safe to get vaccinated if I'm breastfeeding? Who would like to take that one? Carolyn, you do? Okay, great.
Hi. Yes, it is recommended to get vaccinated if you're breastfeeding. I know it was a big challenge or concern, I should say, when the vaccine first came available in January of 2020. In January 2021, that we had many midwives who were still breastfeeding their little ones, and they were concerned about it being newly available and whether they should. And when we went back to look at all the research about other vaccinations and pregnancy and what we had available and the concerns about just passing on COVID to their families, they all chose to go ahead and do that. And we're in the guidelines are still recommending to continue to do that, to get vaccinated if you're breastfeeding. I don't know if somebody has more to add to that or.
Yeah, okay. Dr. Drake, just one moment. Thanks, Carolyn. Dr. Drake, you're now live.
Hi, I'll just reintroduce myself again. I'm Maddie Drake. I'm one of the pediatricians at Southlake and one of the neonatal doctors in the NICU. So I actually was a breastfeeding mother in January 2021 and was vaccinated after I read again the previous vaccine safeties in children and did some reading around mRNA vaccines and how they worked, which I'm unfortunately not great at describing, but I felt very comfortable getting it and I absolutely did not hesitate and I ran down to get it as soon as I heard it was available to me. Also in terms of potential benefits, I don't know if the studies have been printed yet, but preprint studies and there's been some investigations into is there any effect on breast milk in terms of COVID antibodies, and it does show to have IgA and IgG antibodies. The IgA, it doesn't prevent it doesn't act like a vaccine in the breast milk, but the IgA antibodies coat the mouth and can potentially provide some localized protection about COVID. We don't actually know whether it does in COVID with the COVID-19 vaccine. We have shown with other vaccines in the past or previous infections in the past, it can potentially help. So there's some potential benefit there as well.
Okay, thank you.
Can I add something else?
Sure.
So I just wanted to let people know a really good resource about breastfeeding and the COVID vaccine is La Lèche League Canada has some information. They're saying they're not medical people and they don't make recommendations, but they kind of summarize all the important bodies and what their recommendation is. And the two I wanted to point out was the Academy of Breastfeeding Medicine, which is the international organization that kind of is looking at breastfeeding and breast milk and breast. They recommend that all breastfeeding women, that they recommend that breastfeeding women get the COVID vaccine, and they recommend that people don't postpone breastfeeding or discard the breast milk after getting vaccinated. The American Academy of Pediatrics also recommend that people who are breastfeeding receive the COVID vaccine. But all these organizations and their recommendation is on the La Lèche League Canada website.
Okay, we're going to do, we'll send out a document with the Q&As in it afterwards, so we can include those resources in it for anybody who's interested. And so speaking of sort of resources, and I guess there's a database for adverse reactions. Dr. Tang might be the best to answer this one. Can I ask why the VAERS website, so Vaccine Adverse Event Reporting System, says otherwise when looking at adverse outcomes for pregnant women? Why is there a difference of opinion between what's being said and the data? And when I go to this website, I just checked it out. It just it says quite a high number of COVID vaccine related deaths and adverse events.
Sorry, I'm not familiar with that website. What's this website?
It's called the Vaccine Adverse Event Reporting System. So VAERS. openvaers.com. It was just put it in the chat here. I'm not familiar with it either, but it seems that the numbers are higher than what's typically reported, I guess.
Can I get you an answer? Let me just look at it and see who runs the site and do some investigation before I answer that question, because I don't know this site.
Sure.
I'll defer, give me 5-10 minutes.
Yep. Okay, sure. So we also have some questions about vaccines and fertility. Or fertility concerns. Who would like to, well, Dr. Chang is researching, who would like to take these? Maybe Carolyn? Great. Okay, so can we be certain that the mRNA vaccines don't cause infertility? A lot of young female nurses won't get vaccinated for this reason, which puts them at risk. Has enough testing been done on this?
Well, like Dr. Chang mentioned earlier, there's, a lot of live information coming out right now. And historically, there hasn't been any negative effects of any vaccines affecting fertility. I think there was some misinformation going around at one point during COVID around the vaccinations affecting women's ovarian function. But that hasn't been reiterated in any of the recent research, nor has it shown up with any of the numbers being when they've gone back and looked at the women who have been vaccinated. There hasn't been any known increases in infertility issues, anything higher than the normal population as well. So the answer, and because of the benefits of getting the COVID vaccine, is why it is still recommended to do so. because of the ill effects that you could have from getting COVID and those effects on your pregnancy.
Okay, thank you. Also, is there a risk if you're undergoing fertility treatment? So IVF or egg freezing are the examples that were given. Is that still you, Carolyn?
I'm not too sure, but I think Dr. Van Schaik had her hand up.
Oh, great. Okay, that's it.
Thanks, Lindsay. Yeah, I'll defer that one to Genevieve specifically, but I was just going to build on Carolyn's comment previously and just reminding people that the vaccine is A, it's not a live vaccine, and B, it does not enter your DNA. So from a fertility perspective, very scientifically, those risk factors are not embedded in your fertility potential as a result of this vaccine. There are some vaccines that are different in that regard, but this vaccine in particular, it enters your cell, it does not enter your DNA, it is subsequently destroyed and excreted and does not have any ongoing sort of living effect in your body to influence future fertility or immediate fertility.
Okay, thank you. We have an update about this VAERS, about fact checking. A couple people put into the chat. So Dr. Chang, you may want to speak to this, but it looks like it may not be fully legitimate website.
So I'm looking at if you're talking about VAERS, that's the Vaccine Adverse Event Reporting System that I'm looking at from the CDC. I can't find this, the one that you're saying that show that there's adverse events. So this is for any vaccine and you report side effects. Now, just because you have a side effect, like we know that there's very common local side effects, pain at injection site, low-grade fever. So I can't see the data for the COVID-19. So I'm not sure, like just because there's reports doesn't, the side effects that are reported can be normal things from vaccination. If you can send me to the link of the report because I can't find it, then I can comment more on that.
Yeah, it's in the chat and published, but it looks like it's been kind of debunked as maybe having some false information from AP News and another site here, McGill.
Okay. Because according, as far as I know, the CDC, if you look at the CDC summary, they're saying that we haven't seen any adverse events related to pregnancy for the COVID-19 vaccine.
I think that's just a good point, that this kind of information is going around and it is not always accurate, and you really need to look at the source that's providing this information and listen to people that you know, the experts and people that you trust.
Dr. Van Schaik has her hand up.
Okay, great.
Yep. Actually, I was just going to say the same, Lindsay. I think it's really hard for people, right? Because you look up information like this about the vaccine adverse events, data pool and trying to do your own information seeking. And then it's very easy for people to sort of use that acronym and potentially drive you somewhere else that may not have the most accurate information. And so it's really tough. And I thank people for bringing that sort of stuff forward so we can look at it specifically and see, is that the actual website where it's actually registered for adverse events and the data that they push out? Or is it some sort of slightly adjusted link that biases it with different information? And our goal is really just to have the factual information for everybody to make their own independent decisions with. And the more we can understand what misinformation is out there, because when we do our own researching, we're trying to sift through it as well, but we get fed very specific and we look for very specific information in studies, and then we decipher those studies equally and independently as to whether they're quality or not. So it's not just fed to us as sort of take it at face value and accept it, but we do have to decipher through it as well and decide what legitimate research is even quality research. So if you're seeing more information, please do share it with us, because we're quite happy to look at it and decide and help you decide how legitimate the source is.
Yep. Thank you. That's a good point.
Can I make, Lindsay, can I make another comment about the pregnancy and fertility and miscarriage thing? So this all started because some Pfizer employee was asking a question and posted on a blog about that there were 45 amino acids that were common between the spike protein, the COVID-19 spike protein, which is what the vaccine is producing an antibody against, and a protein that's made that has to do with placental function. But this has been completely, so that website was taken down, the blog post was taken down soon after it went up, but just like a lot of misinformation, it's been propagated even though it was not really true. Just as a few comments. So they were worried about 45 amino acids. The whole placental protein is 538 amino acids long. So just because you have 45, like, I mean, there's only four amino acids. So you're gonna have repeats. That they've looked at this in a few ways. So one of the ways they looked at this is when they were doing the trials, you know how I told you pregnant women were not allowed to be enrolled? That was true, but that doesn't mean people didn't get pregnant after. So there were 57 accidental pregnancies in the 3 vaccine trials. And they've compared the accidental pregnancies to the ones who, they've looked at those pregnancies and compared them to pregnancies in women who were not vaccinated. And there were no increased miscarriage rate, and there were no less accidental pregnancies. So that means that there is no effect from that small number. These were people who were vaccinated. They were not intending to get pregnant. They got pregnant anyways. So that shows that there is really not that much effect on fertility. The other way to look at this is this spike protein is present in people who get infected with COVID, right? Like not just people who get vaccinated with COVID. These spike proteins are part of the COVID virus. So if you had a natural infection, you would also have this spike protein. And then if you looked at the COVID infected group, when they're like after they recovered, they don't have a higher miscarriage rate either. So that is another way of saying that no, there is no effect on fertility.
Okay, sounds good. Looks like that's it for the questions that have been submitted. So if anybody else has anything you would like to ask, please feel free to put it into the chat. In the meantime, did anybody have any points that they would like to talk about while we're still here?
Jenna had her hand up.
Oh, great.
Yeah, I was just, can I be heard? Can everyone hear me?
Yeah, you're good.
Oh, okay. I was just going to add that I actually, in regards to what Dr. Chang was saying, I actually got pregnant this cycle after I had my COVID infection. So in terms of like fertility, I got pregnant the cycle after I recovered from the infection. So
yeah, that's good to know.
Yeah.
Does anybody else have any information to add? Oh, Dr. Van Schaik.
Lindsay, I was actually just going to ask you if Dr. Drake wouldn't mind speaking to just prematurity and sort of what the common elements of prematurity effects are for baby.
Sure. Send you live, Dr. Drake.
Hello again. As Dr. Van Schaik mentioned, I'm one of the neonatal doctors who primarily takes care of preterm babies in our NICU. So prematurity is a huge spectrum, and I always discuss this with parents, from extreme prematurity at 24, 25 weeks to late prematurity 35, 36 weeks, like Jessica's baby. And neonatal care has advanced significantly, so we have better and better outcomes with preterm babies, but there is still a significant burden on families and these children. One of the things I think Jessica alluded to specifically is separation from family. So if these babies are admitted to the neonatal intensive care unit, that is separation from families, even if you're not admitted to hospital with COVID. Babies, when you give families ballparks, depends on the level of prematurity, but they are in the NICU primarily learning how to feed until they are close to term or late preterm. So depending on when they're born, that's a long time in hospital and a long time away from their families. There are complications with prematurity. I don't think I need to go into those today, but there are complications, increased risk of infection, jaundice, stuff like that we manage in preterm babies. And there's also long-term neurodevelopmental implications depending on gestational age, and these babies do require long-term neurodevelopmental follow-up.
Okay,
I don't know if
thank
anyone
you.
has any questions or anything regarding prematurity for me, but I'm happy to answer them.
Okay, great. Yep, if you have questions about that, you can please feel free to send them into the chat. Anybody else have any comments or remarks?
I wanted to make another comment if I can.
Mm-hmm.
We know that pregnant women are worried about their babies. We know that in US, only 30% of pregnant women are fully vaccinated. And in Canada, according to our Ontario data, only about 28.4%. This is as of June, end of June. Only about 28.4% of our pregnant women have received the COVID vaccine. And that really worries us as caregivers, because we do know that if you get COVID when you're pregnant, your risk of being hospitalized is 4 times higher than the same person who's not pregnant. Your risk of having a tube down your throat is, I think, 3 times higher, and your risk of ending up in the ICU is like much higher, as 10 times higher actually. So we worry about our pregnant women and what happens if they get sick with COVID. The other thing is, we also, as we're getting more and more information, we also know that it's not just effects on the mom. Now we know about the premature labor that Dr. Drake is talking about. And then there's some data now that says that the risk of stillbirth may be also higher. And we know that the risk of preeclampsia, which is a condition with high blood pressure in pregnancy, is also higher in women who have been infected with COVID. So there is no way, no matter what the doctors say, there's no way we're going to be able to give you 100% guarantee that the vaccine is safe, because the vaccine has only been out for a year, less than a year, and we don't have, although we have animal studies that show it's safe, we don't have studies on what little Johnny will be like at age 5 or age 10. But the risk, the real risk of getting COVID and its effect on the mom and its effect on the baby, that we know for sure now. Like that we can tell you right now that your risk of being hospitalized is higher, that your risk of going to the intensive care is higher, that your risk of prematurity is higher, that your risk of stillbirth is higher. That's not theoretical. That's data we have now, just living with COVID for the last year and a half. So when you're trying to decide, should I get vaccinated or not, you should try and compare those two risks. It's not just, risk of getting vaccinated and the theoretical risk of the vaccine. You also have to remember, what is my risk if I don't get vaccinated and I get COVID?
Yep, thank you. That's helpful. A couple more questions have been sent in, so I'll ask it. I'll put whoever's best to answer up. Is there any fact behind the COVID vaccine and disturbing someone's menstrual cycle? Who would like to take that one? I'm not seeing any volunteers here.
Dr. Chang.
Dr. Chang. Okay, great. Go ahead.
I've heard of it, and actually, I don't think there's been I mean, obviously there's no randomized trial. There are reports of people getting the vaccine and having a heavy period after or the next cycle, and I haven't found a good scientific explanation. Like, I haven't seen anybody come up with a reason other than saying, stress or any kind of disruption or can affect periods, which is true. So I haven't found a good explanation. I have heard it, and I've heard people, my friends, who've told me that. But what I can assure you is it has no effect on fertility. So, it's a temporary thing. I have no idea why.
Okay, thank you. And then there are talks about the third booster vaccine, so third shot. Would it be safe to get the booster while pregnant, or any increased risks, I guess, or should you wait? Yep, Dr. Van Schaik, I'll send you live.
Thanks, Lindsay. Yeah, happy to take that one. So we're starting to do the third doses for our cancer population at present, just from the perspective of the provincial and national recommendations for this group of individuals whose immune systems are already compromised, and feeling that their response would not be necessarily as strong to the previous 2 doses to get as good a vaccine efficacy as other people. With respect to third doses or booster doses for a pregnant population, I have no concerns in that regard, and I'm sure our other panelists can share their thoughts and information as well. But really, the idea is simply to enhance one's immunity in terms of optimizing it, giving your body a bit of a kickstart to where it's at from the previous 2 doses. And the target is to be able to do that in people who we feel would be most affected by infection with COVID. And so that's why you're seeing it in the immunocompromised population. I'm expecting it to come with some of our other high-risk groups that were identified in our vaccination process, for which pregnancy was one of them. And I've also been asked about healthcare workers, and are we expecting that? And I am expecting it, because we are a population that are more exposed than the average population. And so, as I said, it's the booster is meant to sort of give you a kickstart to your waning immunity over time. And the third dose, although they sound very similar in, third dose versus booster, the third dose is really meant to do the same, but to a population of people whose immunity may not have been as strong when they received that first and second dose vaccine. Both are well studied and safe. And certainly through the United States and Israel, they've been looking at this most completely and had the most experience with it, just in terms of where they are in their vaccination process. So both with pregnant people and with healthcare workers specifically in research studies.
Okay, thank you. A couple of questions just came in. So I have a family member who is wary of impacted fertility because of the vaccine, considering their PCOS. Do you have any specific information that could be relayed onto them to address both PCOS plus vaccine and infertility concerns?
No.
Okay, great. That's the end of that answer?
I mean, I haven't seen any, I haven't looked, to be perfectly honest. We know that PCOS, which has irregular periods where they don't ovulate regularly, have a higher risk of having issues with getting pregnant, okay? As I said, we have not seen any evidence that the vaccine causes infertility or adds to infertility. I haven't seen specific studies on PCOS and the vaccine. While I have the floor, I'm looking at one of the questions, and it was one that was dismissed about whether Southlake was keeping stats on vaccinated women who have given birth to stillbirths or preterm deliveries, and if not, why not? Well, the reason why not is we do 3,000 deliveries a year. We have about 6 stillbirths a year on average. And if we have 7, it's hard to say because our numbers are so small. We can't tell you whether that was a meaningful increase or that's just a random event. Having said that, the reason why I'm bringing this up is if you want to look at the Canadian Medical Association Journal, published in April 2020, they looked at the reviews of over 400,000 pregnant women, over 42 studies, and they looked at the outcome of stillbirth, gestational diabetes, and other bad outcomes. And I just wanted to give you an example of the data. So first is they compared pregnant women who had COVID infection with people who did not have COVID infection. And the risk of preeclampsia was 1.3. That means it was 30% higher in the pregnant women who were infected. And the risk of premature delivery was 80% higher in the pregnant women who were infected. And the risk of stillbirth was 2 times higher. Now, when they look at it further, and they only looked at the people who had the pregnant women who had severe COVID infection compared to non-pregnant, the risk of preeclampsia was 4 times higher, preterm delivery was 4 times higher, low birth weight was 80% higher. So I don't have Southlake specific data because we have our small hospital, and to be perfectly honest, we're so inundated, we have no time to study this right now. But there is data out there. People are looking at this. So this is not, there have been studies. Now these are observational. They're not trials where they randomize people, but there are data showing that there is adverse outcome related to COVID in pregnancy.
Okay, thank you. Thank you for speaking to that. I wasn't sure how to ask that one.
Lindsay, if yeah. I can just build on that a little bit.
Sure.
Yeah, just to Dr. Chang's point, I think that's a really important issue in terms of numbers, and that's a factor in how we look at side effects, how we look at outcomes in research. And so at any level, to get good information on something like that, that's why you're looking at provincial, national, and international registries so that you can pool that data, have a broader number of experiences in terms of number to really understand what that impact is, because you don't want to not see something that is there. And at the same time, you don't want to make a false interpretation based on too small a number. So it's a really great question and a really good point. And we do submit our information to the National Registry, which everybody is collecting on pregnancy, but individually, those numbers are just too small to comment on.
Okay, thank you. And question has come in here about convalescent plasma therapy. I cannot find anything related to if the antibodies are depleted or diminished, or the percentage of antibodies dropped or weakened after receiving plasma therapy from those individuals who have vaccinated. Is there anybody who can speak to this? And then somebody did put a, you're already up, that's convenient. Somebody did put a Mayo Clinic article here, which could have some good information, hasn't vetted, but they're usually a good source. Go ahead, Dr. Van Schick. Oh, I think you're muted.
There you go. Great question. We get asked this from time to time, and it is an evolving area of, COVID-19 research. But in simple terms, and I hope I'm understanding the question correctly, convalescent therapy from people who have received the vaccine as a donor is not something that's specifically recommended. It is after infection, and it is beneficial to collect that treatment plasma, because just the number of types of antibodies that are otherwise collected as a result of your infection is far greater than from vaccination alone. So, by example, the vaccine targets the spike protein. And so you produce antibodies related to that. So as a vaccine recipient, if you donate convalescent plasma, you're only going to really get the benefit of that particular antibody. But after COVID-19 infection, you have produced antibodies to a variety of aspects of the COVID-19 vaccine, not just unique to the spike protein. And so that's the reason for which they say, if you've been vaccinated, it's not beneficial to donate convalescent plasma, but if you've had infection, there's more benefit in that. So that waning principle factors in because of just the sheer variety and number of antibodies that are in the plasma related to what the process was, be that illness or wide variety of other antibodies or COVID vaccine, which is targeting the spike protein.
Unmuted. One more question about the booster. So if a booster / third dose is made available to pregnant women, do we expect that it would also be made available to their primary caregiver as well?
Yeah, I'm not sure. I think initially that was the case. Obviously, we were supporting the primary caregivers for the expectant moms as well. Certainly what we're advocating for in terms of risk, I think the feeling will probably be that the primary caregiver won't be at as high a risk as the expectant mother, but certainly what's being advocated for at our local level, community level, and provincially.
Thank you. That is it for questions. So did anybody have anything that they would like to close out with? A few minutes left. If there's any lingering information that somebody would like to. No? Okay. I guess that's all. So, oh, sorry, Dr. Van Schick, you're muted.
Yep, sorry. Having one of those days. I just want to thank everyone for participating today and sharing their questions, their concerns, and helping us to understand where to add clarity and add information for people so that they can make the best decision possible for themselves. If future questions come up and people are unsure of how to find the correct answers, please just feed it through to corporate communications or our town hall, and we will address them separately and find that information for you. As things continue to change and evolve, and as we learn more information, we will always communicate it in our town halls and/or our frequently asked questions section, and Lindsay will take that from each one of us. We have provided some resources, so please look to those. And if there's others that you understand and want some feedback on, please share them with us also. But thanks to each of our panelists as well for your time and passion around trying to help people in their decision making.
Thank you.